Hi, good afternoon. Hi, good afternoon. My name is Dr. Nitin Butala. I'm a neurologist and neurophysiologist with Baptist Neurology. Um, Today, we're going to discuss about one of the very common sensation, one of the very common symptom, which is experienced by all of us, most of us, sometime in our life or maybe daily basis. Uh, it's numbness. It's actually described in a variety of ways. Some people describe it as numbness. Some people describe it as paresthesia. Some people will say tingling, burning, creepy crawly sensation or bug crawling sensation. So basically, it's a disorder of sensation, loss of sensation. It can be described in a variety of ways. The most common example is when we cross our legs, or sometimes we put pressure on our elbows, like the funny bone sensation. So the topic, the most important thing is whether it's something uh, benign or whether it's something serious, and that's what I thought that this topic is very interesting for patient education purpose. And definitely, most of the times the numbness could be because of something benign and simple, but there are areas, some disease processes or some instances where it can be a manifestation of a serious disorder. So that's that kind of pretty much summarizes the broad numbness or paresthesia category. Now, let's discuss. Oh, by the way, if you have any questions, feel free to type because I can see them. I would be able to see them. I have the accessibility to see your questions. So anyway, so let's discuss what are the causes of paresthesia, numbness, or some people describe them as itchiness or nervousness, or they describe it in a variety of ways. So I'm a neurologist, so basically, the way I describe the causes will be like how when you have a some sort of problem with the bulb at your house, so bulb is not working or the lights is not coming out. There could be a problem in the bulb itself, there could be a problem in the socket, there could be a problem in the wiring, there could be a problem in the button or switch, or there could be a problem in the main pole. So that's how we need to look at it. We need to look at it where the paresthesia symptoms are coming because of a problem in the brain, cervical spine, or your lower spine, lumbar spine, or lower back, thoracic spine, or your plexuses or the nerve plexus which come out of your spinal cord, or it's your muscles or peripheral nerve. So that's how you have to look at. Now, that's from the neurological standpoint. Now, is there anything else which could cause numbness, paresthesia symptoms? Well, definitely yes. There are a lot of systemic disorders like diabetes, kidney, renal impairment, some of the other autoimmune conditions, thyroid conditions, sometimes some cancers, sometimes medications. So there are a variety of etiologies which can cause. Some of the most common thing will be people working with their hands, day-to-day life, repetitive hand motions, like we all work on the computers, manual laborers, people using their tools, people using machines, like chefs working in the kitchen, laborers, using their hands for operating machines, mechanics. Now, in pregnancy, women get swelling in their hands or feet. Sometimes that can also cause you to have this type of paresthesia symptoms. Now, so when we talk about paresthesia, we have to find out we have to discuss about whether is it just certain area or is it everywhere. So because that helps to decide whether you need any specific testing. So most commonly, in my clinic, I see patients coming with tingling numbness in their hands. So now we ask them questions. Where is the location of the numbness? So depending on, say, more like what we see more commonly, tingling numbness symptoms in the first three. Sorry about that. first three digits of the hand. That's like the median nerve distribution. That more likely like a carpal tunnel syndrome. If it's the fourth and fifth digit, it's like ulnar nerve distribution. Now, I'm making it sound very simple, but it's not as simple as it sounds. But you have to kind of localize the, where the symptoms are, where the distribution is, and then decide. So that's more likely like a peripheral nerve. So in peripheral nerve also, whether it's a one nerve distribution or more than one nerve distribution, or if it's involving your whole arm, whole leg, or the arm, leg, and face, both sides versus one side. So that's where it becomes a little bit more complicated localization wise. Systemic disorders, usually you will have bilateral kind of symptoms. In peripheral or mononeuropathy type of situation, you'll have it more like a localized distribution paresthesia symptoms. I'm going to take a break here for a second. Let's see. Some people are asking questions. Is it normal to have numbness in the limbs during the sleep? Well, there is a condition called as restless leg syndrome. Sometimes you can have tingling numbness or kind of like uneasy sensation prior to sleep. During the sleep, if you have any certain systemic disorder, you can still have, or sometimes it could be a manifestation of something else. Is there a cure for trigger fingers? Well, trigger finger is more than, it's more than nerves and muscles. I think it's a combination of musculoskeletal issues. But there are actual treatments for that, and we can talk about that later. So let's go back to the schematics here. So we discussed about the causes. Now we want to discuss about how is the numbness diagnosed. So basically, you can start with your primary care provider, and they can you could kind of ask you some questions. They will do some brief screening labs. Some of the very common, you may not realize it, but vitamin B12 deficiency, that can actually give you paresthesia, tingling, numbness symptoms. So your primary doctors will look at those type of conditions where whether it's whether there's any systemic thing going on or not. If they feel that okay, it's more than that, and they want you to see a neurologist, they will send you to a neurologist. Now, neurologist will ask you, of course, more broad questions. They will examine you. They will look at your strengths, sensations, reflexes. They will go through the chronology, whether the numbness is something or the paresthesias are something which is happening just once in a blue moon, or it's constant, it comes and goes. What are the triggers? Did something cause it? That kind of helps us, to decide what kind of workup do you need. Most commonly, you may need something what we call as EMG or nerve conduction study to localize whether it's coming from the peripheral nerves or muscles or your spine. It's coming like radiculopathy or pinch nerve. You may have heard that word. But if it's more than that, sometimes they will order more testing like neuroimaging, laboratory testing. As I mentioned previously, sometimes systemic disorders, autoimmune conditions can also cause, like rheumatoid arthritis, lupus, sarcoidosis. They can also manifestation with, they can have some peripheral nervous system manifestations with paresthesia. Sometimes, patients who have a history of cancers or cancer treatments with chemotherapy, they can have neuropathic complications, and they can have symptoms due to that. Patients with renal impairment, they can have restless leg syndrome. Patients who are on some of the antiarrhythmic drugs, sometimes patients even anti-seizure drugs like Topamax can also give you paresthesia as a side effect. So it involves a lot of thought process behind what test to order and how to reach to the conclusion. Patients with more like neurodegenerative disorders like or autoimmune neurological disorders like multiple sclerosis, sometimes you can have paresthesia because of the strategic location of the lesions. Sometimes patients who have had lacunar strokes, they can have residual paresthesia because of thalamic strokes. Patients with a brain tumor which is located in a specified area of the brain sometimes can present with tingling numbness. So it actually becomes very complex, so that's where the history, examination, localization, the chronicity of the symptoms, acuity of the symptoms plays a role. Now, you may have heard shingles, patients get shingles attacks, and then after that rash is gone, they are left over with the really severe pain, paresthesia symptoms. So that's another, area where, you can experience these symptoms, and it's completely different etiology. Sometimes you can have disc disorders in your neck or spine, cervical spine, thoracic spine, and they can also cause you to have neurological symptoms. I mean, the paresthesia symptoms. So it actually, you have to do a very detailed and thorough evaluation of these patients and then decide the plan of action. Now, so to briefly summarize that, nerve conduction studies, laboratory testing, EMG nerve conduction studies, neuroimaging, sometimes X-rays. Those are some of the most commonly ordered tests. Now, there are treatment options. So how can we manage some people might ask this question, how can we manage or how can treat? So it depends on the etiology. Now, say, for example, if we find that somebody has really low vitamin B12 level and your doctor thinks that that's the cause of the paresthesia, well, that's simple. You replenish that and you have an answer. Now, in some cases where patients have neuropathy because of untreated or uncontrolled diabetes, well, in that situation, you don't only need you not only need the treatment of the paresthesia symptoms, but you also need strict management of your underlying etiology, which is diabetes. Now, for symptom management, there are neuropathic pain medications, which are mainly gabapentin, Lyrica, sometimes amitriptyline. Some patients don't want medications because of the side effects. They can use creams, ointments. There are some vitamin, like multivitamin pills, which can be used for neuropathic pain. So there are a few options there. Now, if your symptoms are because of underlying systemic condition or any other, like a thyroid condition or sarcoidosis, so the treatment of that primary condition is going to help you. Patients with restless leg syndrome, the paresthesia due to that, you have some different treatment options for that. So it depends ultimately on the causative mechanism. Now, patients with carpal tunnel syndrome, they have, basically it's because of the compression of the nerve. So carpal tunnel syndrome is the most common presentation. Now, you can also have compression of the ulnar nerve at the level of the elbow, which can also cause you to have paresthesia symptoms. So it depends on what is the mechanism. So for carpal tunnel, we recommend using a wrist splint. For elbow, unless you need an intervention, we again recommend wrist and elbow splint. Sometimes, patients, case by case basis, patients may need referral to an orthopedic doctor, hand surgeon, or sometimes if it's a disc issue compressing on the spinal cord, they may need intervention from neurosurgery. So, and many times, we don't find any, obvious cause or anything where we need intervention. In that case, I have sent some of my patients for physical therapy, because we have to look at patient's posture and some other, aspects of their day-to-day life, and sometimes that helps. So the next thing on the list is here, when to seek medical attention. So as I was saying, most of the times the paresthesia is benign, but could they be because of something serious? Yes, definitely. Yeah. So you may have heard this ad about stroke, any acute onset of paresthesia symptoms. So basically it was not there and it suddenly comes, it involves your face, arm and leg, or your paresthesia symptoms are accompanied by some of the other serious symptoms like loss of consciousness, vision loss, dizziness, and they are not explained by something like, what we did, like, compressing the arm, compressing the legs, So if it's not explained, if it's acute, if it's not going, it's accompanied by some other neurological symptoms, then definitely yes, you should seek immediate medical attention. There is also, sensory seizures have been described where patients only get like paresthesia in a specific distribution, and they are not accompanied by loss of consciousness or shaking, twitching, which is noticed with seizures. So that is a possibility. Sometimes patients can have complex migraine where you get your typical migraine symptoms like headache, nausea, sensitivity to light, but they also have accompanying symptoms of paresthesia. So that's sometimes can be scary. It almost sounds like stroke. So patients have been to the ER for evaluation of those symptoms. So basically, if it's more than paresthesia, definitely, one needs to take immediate medical attention. Now, we are in flu season. We are in, viral infections. We're talking about COVID. So I have to I'm not trying to scare anybody, but I have to just make a mention that, if the paresthesia is rapidly progressing, like they're, starting in the feet or hands and then progressing towards proximal arm, proximal feet, to the point where patients are having, leg weakness, arm weakness, breathing difficulty. That is actually a sign suggestive of like a life-threatening neuropathy, which is also called as Guillain-Barré syndrome. It's acute. It's within days or sometimes within hours, and this patient needs to go to the hospital immediately. So there is a gradation, signs and symptoms, and it depends on the how progressive or how acutely the symptoms are progressing. So when in doubt, definitely call your doctors, and seek immediate medical attention. So I guess I covered the topic with what is numbness, paresthesia. We discussed about possible causes. We discussed about what to do for diagnosis. We discussed about treatment options, and we discussed about when to seek medical attention. So I guess I covered most of the things which come to my mind when we talk about paresthesia. And I think I did mention that sometimes you may need to see not only a neurologist, but some other specialists like rheumatologist, endocrinologist, depending on, what is the, so when you see a neurologist, they will do, especially when your nerve conduction studies are normal or neuroimaging is normal, physical, your neurological examination is normal, and you're still having symptoms, we may send some labs, may get some opinions from, other subspecialties, like especially rheumatology or sometimes, endocrinology. So that will happen. Physical therapy is helpful. And many times you may have for example, if somebody has arthritic changes or disc disease causing pinched nerve or cord compression, so they may have they may undergo surgical intervention, but they still have some residual symptoms or residual paresthesias, and in that situation probably they may benefit by using symptomatic medication, which I mentioned: gabapentin, Lyrica, amitriptyline. Sometimes we also use Cymbalta. So those are some of the symptoms which some of the medications we use for symptomatic treatment. Again, these are symptomatic treatment. These are not curative treatment. So the curative treatment will be what is causing it. So again, that depends on localization. That depends on where the symptoms are coming from, or the treatment of the primary condition. And many times the primary conditions may not be completely curable, treatable. Like for example, diabetes, cancer. So we have to take into consideration those. Many times, like something, if it's like a medication side effects, like some of the antiarrhythmic or antiepileptic medications do have side effects of paresthesia. In that situation, if we remove the offending, drug or medication, you can expect complete recovery. If it's because of vitamin B12 deficiency, yes. If once you replenish that, you can expect complete recovery. As long as there is no permanent, nerve damage or permanent changes in the brain or C-spine or, neuroimaging studies, I think that we can expect, So it depends on, there are a lot of, a lot of variations here, as far as the management, as far as the treatment and, the diagnostic workup. But definitely, yeah, I mean, if you're experiencing, which is not like your usual, not physiological, like, I mean, I don't mean to, like, you don't need to go to the hospital if or go to the doctor if you know, like, okay, you pressed on your elbow or you pressed on your wrist and you're having some symptoms. You don't need to go to the doctor for that. But if it's persistent, not resolving, and it's unexplained, sudden onset, or chronically present there, or accompanied by many other neurological symptoms, then definitely you need to have a treatment. Um, all right, so I guess I'm available for questions for next few minutes. So feel free. Let me go through these comments here. So I think we discussed about sleep and numbness. We discussed about trigger fingers. Okay, so somebody mentions that I experience loss of feeling in my left foot that never goes away. Right foot is slowly developing the same. It's like walking with a foot made out of Play-Doh. It's causing some falling. When I saw you as backup neuro, because mine had a baby, you said it was crossing from my ankles, but I have been working on avoiding that, and still there is. Is something I should just keep dealing with it, or? Well, I think my suggestion will be, if we have not done nerve conduction studies, we should do that. I would like to examine you. Maybe we can send some laboratory workup, and maybe we can try some symptomatic medications. It's depends. We can reevaluate you. Definitely, will be happy to do that. I don't know when was the last time we did your neurological evaluation, so definitely will be happy to do that. I guess you just mentioned that you already have the nerve and muscle testing. So I think the next step should be probably maybe doing some laboratory workup to see if you have any other inflammatory or other conditions. Sometimes, a lot of times, I get patients who complain of paresthesia, tingling numbness at the bottom of their toes. And there is this thing called as Morton's neuroma, or it's like a bony kind of outgrowth. Sometimes you have calcaneal spurs in the foot, and that can also cause you to have foot paresthesia. So it depends. We need to examine you. We need to look at it more carefully again. And sometimes we don't find because we know the diagnostic testing, the EMG nerve conduction studies, they only check for the big trunks. They don't check, like, we don't have ability to check in each nerve fiber in the body. So many times if you're symptomatic, and if the symptoms are affecting your day-to-day life or preventing you from doing certain things, it doesn't hurt to try a medication to see if it helps you or not. But the medication is something, now this is not something like a migraine medication which you take only as needed. If you decide to take a medication, you will be on that medication for a while, and you need to take it whether you're having symptoms or not. So that's another caveat here, and the medications do come with side effects. So, your doctor will talk with you, will weigh the benefits and risk and decide, so that's what I would have to say about this. Anybody else? Please feel free to ask questions. Not sure. Somebody says I'm on gabapentin. Okay. Yeah, if the gabapentin is, so it depends on the dosing, how much dose you have. Sometimes, we have tried, it depends on gabapentin. It depends on your, how higher dose you can tolerate, I have some patients who take really high dose of gabapentin, and some patients are very sensitive to the 100 milligram, which is the lowest possible dose. So it depends on, the goal will be to have least amount of side effects and the maximum amount of benefits. That will be the goal. If you have tried gabapentin and if that's not helpful, the next step will be to try the Lyrica, or sometimes we can try amitriptyline and see if that helps you. We'll be more than happy to evaluate you back. Anybody else has any questions? Okay, all right. So thank you very much. Okay, all right. So I got it. Okay, no problem. Yeah, you have an appointment with doctor. Okay, good. Okay. All right. Well, thank you very much. I would like to thank Baptist and Brooks YMCA, and thank you very much for your time. And thank you for everybody who attended this. And please feel free to ask questions and talk with your doctors. And of course, if your doctor needs opinion from a neurologist, they will give you a referral. So, um, one more question: are there foods that can make nerve things worse? Well, not definitely, but patients with diabetes, if their sugars are not under control, sometimes that can cause you to have paresthesia. If the sugars are too high, too low, sometimes your electrolytes, metabolites, if they are up and down, they can cause you to have symptoms like that. So that's a possibility. But not specific foods. No, I think one. So that's a good question. So there is actually exposure to toxins and chemicals like heavy metals. So we do check that actually. Heavy metals like mercury, lead. Sometimes they can cause neuropathic symptoms if they are in the toxic level. So arsenic. So we have to take that into consideration. That definitely not a food, but sometimes toxic exposure can cause you to have neuropathic or paresthesia symptoms. And I do to see some of the veterans who were, gone for Vietnam War, and they mention about exposure to Agent Orange, and we have seen neuropathic findings and neuropathic symptoms in those patients. So that's always a possibility, exposure to toxins and chemicals, heavy alcohol use, on more than normal alcohol use, or chronic alcohol dependence. Sometimes that can hurt your nerves. Sometimes, and that can cause you to have paresthesia. Sometimes vascular conditions, they can also cause nerve damage, and that can also lead to paresthesia symptoms. So it's a very broad topic. All right, so I guess I will take your leave. Thank you very much, and have a good day and have a good rest of the day. Bye bye.